When I was finishing my residency training program in neurology, I wanted to do stroke. I decided that was my chosen profession. And when I started thinking about places to come and train for stroke, the best place in the world is the University of Cincinnati, and that's because Joe Broderick was here.
Joe's energy and compassion are two things that it's hard to find anybody in this community that has more energy or passion than Joe, and you combine that with his talent and his intellect, and he really is a driver, and so people listen to him.
He is a master clinician. He's got a photographic memory, and he's just fantastic to work with people in the clinic. He is someone who genuinely loves being a doctor. Joe was one of the founding members of our internationally recognized stroke team, and we have the treatments that we have today for stroke to treat an acute stroke when it happens, largely because of Joe Broderick and the work done here at Cincinnati. So it was an easy choice for me to pick Cincinnati as a place to come for my last year of training and subsequently staying on for my whole career.
We had a meeting with Joe Broderick and his team, and he was made a specific request for funds for the university.
The Gardner family, that's been a terrific sponsor for our institute, and now named after the Gardner family, is the UC Gardner Neuroscience Institute. They provided some generous gifts, and at one point challenged us to try and think about how we could be the best in the country.
We said we liked that, but we would like to think bigger. So if you would think really big, what would that be?
We conceived of the concept of a great building that was truly a home for the neurologic patient, to make their life easy, to be a place that not only could they come to get great care in every aspect for their disease process in the neurosciences, but also all their ancillary tests. To have a building that was so calming and a place that was healing as a place to come, a place that wouldn't be scary, but rather a place that would feel welcoming.
So we went from a single facility focused on Parkinson's to consolidating all the units together under one building, and all of the building would use the neuro aspects of that building, so all the patients would benefit.
Joe's leadership of the UC Gardner Neuroscience Institute really helped with the design of the building. It was a building where we got patients' input during the entire course of the design process and the building process. And so what you see today could not have happened without Joe Broderick.
I can tell you there's a lot of people that made UCGNI come about and become successful. But I can tell you, he is one of the people that we would not have UCGNI if it wasn't for Dr. Broderick. Our community has very few people like Joe who are so selfless and so giving of their time and their talents to the magnitude that he does. Joe deserves to be honored.